Bogino, President of Performance Strategies and Diane Bogino Development. Our guest today is Bruce Salzinger, Doctor of Chiropractic Health. In 1974, Dr. Salzinger experienced a serious skiing-related injury. After 3 months of traditional drug and physical therapy treatments for a herniated disc and bilateral severe sciatica, he was scheduled for low back surgery. Fortunately, a good friend who was going to New York Chiropractic College at the time suggested he come in for a consultation and exam, and then decide if he wanted to continue with surgery. The explanation of his condition from the chiropractic perspective just made sense. He proceeded with a regime of regular chiropractic adjustments, and the rest, as they say, is history. Dr. Salzinger graduated from Life Chiropractic College in Marietta, Georgia, with a Doctor of Chiropractic DC degree. He is also a Diplomate Certified Chiropractic Sports Physician, CCSP. This is a program sponsored by Palmer Chiropractic College. Dr. Salzinger is a member of the medical team at Central American Games, Guatemala City, Guatemala. He is also the first physician in the United States certified in functional foot orthotics by the United States Sports Academy. In addition, he is a member of the medical team at Costa Rican National Olympics, San Jose, Costa Rica. And he is also a member of the medical team with the Auburn Track and Field NCAA Division I National Championships. Dr. Salzinger, thank you so much for being on the show today.
My pleasure. My pleasure to be here. Thank you.
Yeah, it's great to have you. So let me ask you this. Let's start off by asking, how many years or hours of education does it really take to be a licensed doctor of chiropractic?
Well, to achieve the ability to sit for the national board exam, of course, you would have had to achieve getting your doctorate degree in chiropractic through a chiropractic university. To get into that program, you would have needed a 4-year undergraduate degree. So it's really a 4-year undergraduate degree, then you take that, and you could then apply to, for example, in Atlanta, Life University. Their program is a minimum of 4,200 hours, but at the graduate level, you're really looking at about 2 to 3 hours of outside work in conjunction with the 4,200 hours of what they're requiring you to do. So I know for myself, it was at least 15,000 hours till I felt, let's open and I can help you.
So you were dedicated to getting it right for sure. And what is the science, the art, and the philosophy of chiropractic care?
Well, as a chiropractor, we are neuro, the nervous system, muscular, the muscular system, skeletum, your skeletal system, the bones of the body specialists. And then, of course, it's the anatomy and physiology of that and how all that works. Very similar to a medical degree, at least for the first 2 years. They then would go into the interventional legend drug prescription side of approaching healthcare problems. Chiropractically, our philosophy is your body has an innate intelligence that's directed by the brain and spinal cord that's working all the time. To what degree is it being most efficient or not is then somewhat of the philosophy of what we call the adjustment. The adjustment doing what? It is removing the interference from the brain and spinal cord out to every cell of the body. And by releasing that interference somewhat from 100% to somewhat less, not to zero, of course, you're not with us any longer, is really how well your immune system is responding to its surroundings. And that needs to be on a 24/7, 365, God willing, maximum efficiency on a voluntary and involuntary basis.
A lot involved there. Now,
Yeah.
what I've heard this term, what is the subluxation and how is that treated?
Okay, so a subluxation is appreciating that the vertebra of your spine, just like your elbow and wrist and fingers and shoulder, your jaw, work on a system of joints that are held there. Ligaments hold bone to bone, tendons hold muscle to bone, and we can then move based on a voluntary or involuntary response to a stressor. Um, the vertebra of our spine, which protect the spinal cord, and then the nerve roots that come off of that directly attached to the brain, can move out of place and lose their independent motion relative to the one above it and the one below it. That pressure on the nerve then causes an additional pressure buildup that becomes eventually a symptom in some way, either a motor deficit or a sensory deficit, which then becomes treated by the chiropractor in what we call the adjustment. So when you become a spinal specialist, you literally appreciate the precious motion that's been lost, and then you apply what's called an adjustment to reinstate the biomechanical function of that bone. A patient then is given a prescription. Why? Because ideally we want you to hold the adjustments. So people go out of adjustment. It's certainly logical. You're in a car accident, you had a bad fall, you were accosted, a violent type of situation is involved. But accumulated micro traumas over time, poor diet, poor sitting postures, poor sleeping postures, lack of exercise, over exercising, overwhelms at times these precious structural support systems. Your system doesn't luxate, which would be a break. That's not our world, that's the orthopedic world, but it subluxates. And when it does that, that is on an ongoing chronic basis, that's a serious health issue.
Mm,
A
yeah.
typical patient in a health and wellness model practice like mine, you will be educated from when you come in, no matter what attracted you, the gross trauma, workman's comp injury, automobile accident injuries, horrible falls, sports related, etc. You will then be educated in. I like to kid the patients because sometimes they get a little starry-eyed when you try to give them the short list of what they need to do. But honestly, it comes down to so much of what your mother told you to do. Sit up straight. Why? Because you get optimal oxygen in, maximum CO2 poison out of the body on a regular, ongoing basis. Eat your fruit and vegetables. Okay, it can't be more basic than that. In today's world, of course, we would want whole food nutrition. We would want it to be organically grown, picked vine ripe and at optimal potency, and not tainted with herbicides and pesticides that for many reasons, the food supply globally just has to be provided for the billions of people, of course, involved. But ideally, you'd want to be shopping locally, and that then becomes a time challenge for people. But then again, if you want to provide the best fuel, I like to say it in your Ferrari, this is what you really need to do for optimal running of your body. Then you want to have regular ongoing exercise. Go outside and play, your mother said. In today's world, we're addicted to these handhelds and the computers, and we don't set aside at least an hour to get our heart rate and blood pressure and some resistance training. It's just the reality of our physiology. And if you're willing to do those three things, you've got some real wind to your back. If you then throw in a positive mental attitude, because the mind-body connection is a real one, and we know this. And if you express positive thoughts, if you're around people who are more uplifting instead of, as they're now calling, the darkness, this is an enormous difference in how your body's going to respond to the way you look at things and what you'll be able to accomplish. And then fifth, because most people don't appreciate the power of the adjustment, putting this back in touch with this, above, down, inside out. Uh, that's your basic chiropractic approach in my office.
Right. And shopping locally also supports local businesses, which is a good thing. And
Totally.
yes, and having a positive attitude, those people are, it's been proven, or studies have shown that they're more successful than the pessimists. So there you go. So tell us
I can't say it better. It's all connected.
right, it is. And so what types of health problems do people come to chiropractors for?
Well, this was a second career for me, and fortuitously, I was attracted to chiropractic when um, a drug physical therapy approach to a serious sports injury kind of set me back. It's all my parents knew, and um, the perception of what chiropractors did back 50 years ago now was um, very different than what it is now. In that world, you're going to a chiropractor, what? Why? Now, most people are saying you're going to a chiropractor, who? And of course, if you have somebody that you trust, that's done you well, that makes that experience complete all round, you'd be welcome to then to wanting to go. For what reasons? Well, the main reason is, regardless of whether you've been in a severe trauma or whether you've been in something that's accumulated micro traumas over time, when those vertebrae, either one or multiple, are out of place, putting pressure on the nerve, it's like having a 100-watt bulb, but the rheostat is turned down somewhat to less than optimal. At some point, you're going to be symptomatic. And depending on how well you want to take care of your garden, okay, look at this as a gardener. You want to continue to provide good, fresh sunlight regularly. Are you providing good, clean water and fertilizer regularly? You know, when you do, you thrive. And when you don't, you are somewhat less than thriving. It's very similar. So my practice attracts people across the spectrum. Why? Because, well, from the severe injury perspective, it's typically comes along with someone who's representing you in some way. So I attract a lot of that. Why? Because I'm not only good at it, but extreme pain really doesn't scare me. A lot of docs, they get very nervous if pain comes in, and in a medical doctor approach, it's very easy to prescribe some type of pain relieving medication that not is necessarily the cause of your problem, but it's certainly helping to manage it at the time. In a chiropractic office, if someone's coming in extreme pain, you have to certainly have the skills to give them the confidence they're in the right office and you can help them. You are typically not the first stop. Even in this world of Atlanta having the largest chiropractic college in the world, a practice like mine starts 20 to 40 new patients a month. At least half of them have never been to a chiropractor before. Never. So unless you give somewhat of a conversation like we just have, to give them then the differential between our healthcare approach and other approaches that they've heard before, you know, it takes a real skill. That's why they call it practice, you know, and you get people that are tactile, they have to touch it. You get people that are audio, you get people that are visual in how you get them to understand what you do. And I'm very proud, 28 plus years in the same location on Far Road in Buckhead. We've got a very, very busy practice, mostly by referral, because we really take the approach of the education, like some of the questions you're asking me, to give a patient a reason to tell others. Well, what did they do? They just didn't, you know, they put this back in touch with this. And then, God willing, do the other things that tend to then give you the ability to hold that adjustment. So your dentist calls it calls it dental hygiene, and I like to call it spinal hygiene.
Interesting.
Yeah, yeah.
So Dr. Bruce, are chiropractors licensed worldwide, and what percentage of the population go on a regular basis to a chiropractor?
Um, I know we are licensed worldwide, but if you're suggesting that it's in every country, I really can't speak for all of them. I can't speak for North Korea. I can't speak for, call it Sudan. There's probably some places. I know my colleagues have the desire. Most get out with a healing hand and a healing heart to want to treat everybody and to get this message out. When Life University was headed by Dr. Sid Williams, there was a Life Around the World program. And they literally had outfitted vehicles with tables and x-ray that would go to the most remote parts of the world. And they never had a problem manning those in Egypt, in many parts of the world that then were exposed. We attract students from all over the world to come to Life and to the other universities. I'm not saying just there, but I'm of course most familiar with Life. I'm very involved there. And those students then go back and want to do what? They want to help their communities. They want to raise their family. They want to be around their aunts, uncles, cousins. So I would suggest to you that the going percentage of those that go to chiropractors on a regular basis is probably around 15%. It's hard to believe that only about 15% of the population go on a regular basis. And what I mean by a regular basis, for example, in my office, if you are doing most of the right things for yourself, you should at least get checked once a month. Once a month, symptomatic or not. You brush your teeth probably in the morning and afternoon. Probably floss at least once a day. And what are you then hoping? Every 3 to 6 months, whatever they're recommending. You're doing great, Diane. We'll see you in another 6. And you're leaving there happy as a clam, right? You're doing what they're suggesting in between. And that's what we do as well. And a lot of people buy healthcare packages. Health insurance, while an option for a lot of people, there are a lot of people that don't have it. And even those that do, there's high deductibles. They're only covered for so many treatment sessions, so to speak. So a lot of people are very aware of wanting because it works. They see the outcomes, they see the benefits. Those that bring their families, the kids, are a whole different health profile than those families that don't bring their kids. Totally.
Interesting.
Less days missed of school, less days at the doctors, getting prescribed this, that, and the next thing. Infants that come in. I had a woman the other day who was in a bad car accident with her a 7-month-old and her 7-year-old in the other backseat. The 7-month-old, I said, well, how's they been? And she says, well, she's just been a little fidgety and it is not taking to the getting the mother's nutrition. She's just not acting right. And I got to tell you, Diane, fortuitously, could have been a worse accident, but it was what it was. And you just adjust this little bone right underneath where that skull sits on that first vertebra. And it goes in her case, just like a hot knife into butter. It's a very different feel than, of course, a larger person like us who maybe takes a little different amplitude and velocity, speed and depth into the body to put that bone back in. But immediately, the baby just melts in your hands. And what's a normal response? You meet someone you haven't seen in a while. What are you doing? Oh, it's nice to see you. You're hugging, you're patting each other's spine, right? You're stimulating each other's nervous system. It's totally natural. You get a baby that comes in and you hold them close to you and you can hear their breathing and whatever, and then you just gently go because you get the skill over time. Fortuitously, I've been a student of my profession. I try to learn what I know I don't know, continuing education. And so in our office, it's really cradle to grave. That 7-year-old, who of course could express themselves verbally, is able to talk. Man, she goes, what's chiropractor? What do chiropractors do? That was like our first question before the exam even started. It was, you love those kind of patients. And you get a chance to explain it. Now you're explaining it to a 7. Here I'm explaining it to Very different audience, of course, right? But I tell you, she just got up and high-fived me, and it was great. It was great. Is she healed? No, she was in a bad accident, needs a few visits. The mother was hurt worse. Okay, front seat with a, she hit a bunch of things inside the vehicle. It was of such a, it was such force. But so we attract a full spectrum. And I attract a lot of people that are in their 90s and some in their hundreds for all the same reasons. And yes, we hear the algia, the itis, the medical diagnosis, the tinnitus, the TMJ, the plantar fasciitis, the knee this, the hip that. I got to tell you something. Over the many years I've been blessed to still be involved in this, I don't see myself ever retiring, maybe cutting back a little bit. Only because you got to make room for the younger ones getting out of school, and they just have a lot more energy. They just have we've been around the block a few times.
Well,
We're trying to keep ourselves young and in shape.
I'm sure you'll be around a long time.
25 is in 68.
So
it's all good. It's all good.
As you mentioned a while ago, Dr. Bruce, there are a lot of chiropractors around, but what makes you stand out from the rest of the crowd?
Well, I really must say it's the holistic approach to how your body functions. Most people need to be educated as to just because it hurts, for example, here, doesn't necessarily mean the problems. They were, of course, going to look there. You're coming in, that's your concern. Let's take a look. But I'll typically look everywhere, if not the first visit, over the course of the visits. And as a perfect example, a woman comes in yesterday, 12 weeks pregnant. Okay, horrible hip pain. Horrible hip pain, doesn't know where it's coming from. And as we go through the history, she didn't have a trauma, didn't have a fall, had always done Pilates, but didn't necessarily believe it was that. Well, she hasn't been driving much lately. Her husband is doing the driving. And she gets out of the car, she plants that one leg and spins on it. However many times you're getting into the car, planting that one leg and spinning on it. When I tell her I think it's in her ankle, she says, but it hurts over here. I said, I hear you. Let's check there too. I adjusted her ankle and she went, oh, whoa. So I tend to look at the body very much holistically, full spectrum. And it's not that you're always right, but because you've seen it so many times in the past, you want to at least give it a look. And for most people who get in and out of the car, how many times a day? How many women are sitting one knee crossed over the other, then walking around on heels with a bag on one shoulder? I'm telling you, if you don't look at the foundation of your spine from the ground up when you're standing, when you're sitting, of course, where you're sitting, that's a real differential in my office. I'm an extremity specialist, and the mechanism of the injury, having been an athlete my whole life, still very involved. I draw a lot of people from those communities. Give you a different perspective than someone who is just your back and neck. Everybody gets the same type of treatment. Mostly in those franchise type of practices that are chasing the price to the bottom, trying to attract you by how inexpensive and cheap. But when you go there, there's no conversation. They have no time for that. It doesn't meet their business model. Lie down. Everyone gets the exact same thing, no matter what. If you're blessed and fortunate to have found a good doc, and they do have those, there are, I know many, okay? They're not the preponderance. Most are just glad they got a job at a school and they landed there, and then they look around and realize, this isn't what I was hoping for. But those practices are busy, and people are going because I guess they perceive a benefit. But I put myself in the Buckhead community for a reason. I'm a listener. I'll give you my best advice, whether you agree with it or not, and I'll listen to why you might have a concern. But I like to take a little time. It's always been my style. And while I like to see a good volume of people during the day, and I'll tell you why, because you get in the zone. You just get in the zone. You've seen it before when you've done this for as many years as I have, either being involved as the patient and or the patient and the doctor. Um, Truth, you can't take it for granted that you not have attracted something different. But then again, most likely you've seen it or seen something like it before. And you want to respect people's time. So while they'll get their time, you have to be very responsible and respectful of other people who have got to move their day along as well. So I've always been fortunate to have that good balance.
Right.
Yeah.
Yeah, I agree with everything you've told me. I think that you certainly do take the holistic approach, psychology, the food you eat, exercise, and then the way that you treat your patients. So, Dr. Bruce, I think that you may have brought a whole new positive perspective to our viewers about your practice and the type of medicine that you practice. And I appreciate you being on the show today.
Diane, I can't thank you enough for letting me be here, and I look forward to seeing you soon.
Yes, absolutely. Thanks a
Yeah.
lot.
Have a great day.
You too.
Bye.
Thank you for watching Business Notes. We've been speaking with Dr. Bruce Salzinger, Doctor of Chiropractic Health. I'm your host, Diane Bogino, bringing you business ideas you can bank on.